Welcome to our Dates Medics channel. Today we'll be discussing, I'll be discussing with us a diphtheria outbreak in Lagos State and the strategy to curb the spread and safeguard public health. Now, a couple of weeks ago, Lagos State Ministry of Health rolled out a report that there's an outbreak of diphtheria in King's College, Lagos, VI, where 14 students was hospitalized and one died. So disturbing. And a report reaching out from WHO, there has been an outbreak of diphtheria in Lagos State, in Nigeria in general. In 2023, about 21 states across Nigeria was reported to the outbreak of diphtheria. Now, what is diphtheria? You may want to ask, what is diphtheria? Diphtheria is a bacterial infection caused by carinae bacterium species that is affecting the nose, the throat, and sometimes the skin. It causes respiratory distress and all that. What are the symptoms you notice, you will see with patients with diphtheria? The symptoms are fever, we have runny nose, we have sore throat. But there's a typical features of the sore throat of a diphtheria. It comes with whitish, brownish coating on the throat and on the tongue, which make the patient difficult to breathe. At times, they also have neck swelling, skin infection, and in a very serious case, we have difficulty in breathing, cardiomyopathy, heart problem, and all that. Now, how is this spread from one person to another? It is airborne and is highly contagious. So it transmitted from a contact with the infected person. That's the number one. Then another thing, since it's airborne, it can be transmitted from the droplets of the infected person by sneezing and coughing. Then the last mode of transmission is when you come in contact with infected object. You know, people cough and throw things around, and when infected person touches, maybe you want in a public place, you want to enter a room or a toilet, you touch, so it could contact you from there. Now, this is the prevention. How do we prevent this diphtheria from being curb the spread? Now, there are strategies we need to put in place. Government should enforce personal and environmental hygiene in public places and in school especially. The dormitories should be well ventilated. There should be running water in all the toilets, and they should enforce a regular hand wash. It's very, very important. And more importantly, overcrowding. Since the disease is highly contagious, they should avoid overcrowding of the dormitory. In marketplaces, in some places where they are overcrowding in Lagos State, there are some houses where that face me and face you, which should reduce overcrowding because it's airborne and it's highly contagious. And we should also, the main thing is the vaccine. I highly commend the efforts of the Commissioner of Lagos State, Professor Akin Ubayomi, for his timely intervention of rolling out the vaccine in the King's College. I think every schools should compare their work to take the booster dose. There's a booster dose for the pentavalent vaccine. Every child at birth, they take the pentavalent. But as a child grows older, there's this tendency that the immune system will weaken. So every child in all schools, they should encourage the booster dose in all schools, and every just enjoying the booster dose. So I'm very sure I've been able to enlighten everybody on how to curb the spread of diphtheria. For more health talk like this, you should subscribe to Dates Medics channels and also like and share. Thank you for listening.